Welcome all to this episode of your Freedom Hub's presentation of the free market cash patient. I'm your host, Jeff Cantor, along with my co-host, Charles Froman. We're definitely sponsored by Your Marketplace for Health, Wealth, and Freedom, which you can find at your-mp.com. And we are absolutely the disruptors intersection. I want you to realize that there's a problem out there when it comes to being a cash patient or just any kind of a health patient in the world. Even if you think you have insurance, there's an issue and it's pretty obvious. And we're here to kind of help figure out how to break that log jam, because it's coming down to the consumer, the patient, and the doctor to step aside and say, hey, why don't we just get together on this and forget about all these other people in the middle? And of course, there's an awful lot of misinformation, and we're just trying to sift through it. And it's up to you to learn about it, pay attention to everything, and then you're going to come to your own smart conclusions. Just don't fall prey to the first thing you hear on the news. We do have an alternate program earlier in the day. It's all about freedom issues in general, so we would certainly suggest you participate in that. And as I indicated, we do have a great singular address now to get to the website, your-mp.com. And also, if you want to scope out the health program that we typically are recommending, this is the link to get to that. But let's take a quick gander at the site for a fast minute. There's a lot of great drop downs over here. And if you hover over the webinar tab, over home, you'll see webinar, but then you'll also see continuing the conversation. That's your chance to connect with the speakers from every single week, to get involved with them, learn more, blog with them, donate, lobby, whatever makes the most sense for that situation. Under the Freedom tab, there's all the organizations where we've got first the action items that are outstanding, and then all these different organizations we keep adding to that are out there fighting for our particular liberties. And lastly, we're going to get over to today. So if we again hover over home and click on the webinar tab, we end up over here where there's a nice little rundown on the webinars. Here's the description of the one earlier today. Here we are on the right with tonight. A little area where we feature who's coming up. And then most importantly, right down here's all the links that take you to the ones from past episodes. And so here they are, and you'll see there's a lot of them going back a good long time, and they're all quite good. And again, if you fall in love with any of them, you can continue the conversation. But on that note, let's drive into today. So here's where I'm going to let Charles jump in.
Gladly, Jeff and Rick, welcome back.
Thank you.
Rick stepped in on late notice because we actually had another colleague from Empowering Benefits ready to present this week with some excitement, the Individual Coverage Health Reimbursement Arrangement, so-called ICHRA, that Trump expanded, and which promises great opportunity and affordability and simplicity for not just the small group market under 50 employees, but even larger employers. So that guest fell through, and Rick stepped in, which is just as well, because MPB, as we shorten the Empowering Benefits company we both work at, has what I have discovered is probably a better solution, at least for the small group market, and that's the list bill, which Rick and I have done together with a business in his state. It's really easy, and I'll let Rick talk about that, I'm sure, later on. It's funny, Rick, an agent on my team and Jeff's team, is a lot more experienced than Jeff or me. In fact, when I was lobbying back in the 2000s, one of my clients was the Consumers for Healthcare Choices organization run by Greg Scanlon. And a couple of years ago, as I told Greg about this nifty company I've ended up working at that creates cash patients, which is Greg's big thing. He wants cash patients shopping on price. I think, Rick, the story is true. He asked you to check us out. And you did, and you were skeptical, and you are still skeptical 2 years later on everything we do, which is why he's such a good agent. He really wants to protect his customers. He deals with Medicare plans for the retirees. He deals with individual plans, small group plans, ours, others. He really is fixated on giving the consumers what they need, regardless of the commission to him. And so he really keeps us on our toes, making sure we're explaining things clearly, eliminating all the confusion, and really giving patients the simplicity and ease they deserve. Because when you get sick or have an accident, you panic, and you really don't want confusion when you need healthcare to step in. What's really important for tonight as well, and why Rick's a better guest than the person we were having, is that these so-called alternatives that we're engaged with that arose because of the expense of the Affordable Care Act are under assault. And one of those assaults just occurred in his state of Connecticut today that Rick can discuss. And as certain politicians assault these alternatives that arose to help people with the affordability and quality problems, these politicians are jacking up the subsidies to try to corral everyone back into the exchanges, which they left because they weren't satisfied with that market. As Rick will say, he likes the exchanges for a certain role. They have an important role, especially for the sick and the poor. So with that, Jeff, I think I'll let Rick take it away.
All right. Well, Rick, let's hear the news from the front lines. So I'm dropping the screen, and now you'll share yours again, and off we go.
So well, thank you a lot. It's an interesting story that Charles recounted about our commonality with Greg Scanlon, who was visionary and fearless, and a veteran of Maine's Anthem businesses for a long time, and he just aggregated a lot of great people together. Who I met a lot of people from around the country, and Charles is one of them. We've always been pushing for anything that's better than BUCA, and we as a ragtag group tried to create a better than BUCA program years ago, using CARES as a reference-based pricing and self-insurance as a model. The reference-based pricing was based on the Medicare floor, basically, for all charges. And then we decided that Medicare pricing plus 1.40 would be attractive to people. But this is a very, very difficult arena for people to get their hands around, because they think that since they have an insurance card in their pocket, they have insurance. So that's all they care about. They don't want to care about claims. They don't want to care about any of the icky stuff behind the scenes. So we're kind of at a crossroads in this country, and I see it as the convergence of innovation on one hand, which everyone likes when Elon Musk does it, and then the tried and true, the ones that have been here for a long time. Actually, the foundation of my Medicare business, because Medicare is a great program. I'm 71. I like Medicare. I even like the ACA. I hated Obamacare when it came out because it changed my world. But the ACA, as Charles alluded to, is actually a great program for those of us that are in the business trying to innovate, because not everyone can go with a medical cost sharing program. They have pre-existing conditions. One of the ways to keep the pool, if you will, of people in the medical cost sharing world clean and affordable for all the people, all the members who promise and pledge to share their funding with others, is to keep chronic people who are either unfortunate, either choose bad lifestyles or develop a chronic condition, some place to go. So I think it's a fantastic thing. I'm a licensed and appointed exchange agent in Connecticut. So you will not hear me talk bad about that. because I think one of the things that we need to talk about is, can small businesses continue offering health benefits? They're challenged with the current state of affairs. There are not a lot of choices there. One of the things that no one ever really talks about is the fact that for groups less than 50, it is the most heavily regulated insurance product in the country. Every time a newly elected legislator goes up to the Capitol and has a personal story about people that have cancer that need wigs, before you know it, wigs are a mandate. So in Connecticut alone, there's about 60 mandates. When you price them out, they really add to the cost of insurance. So therefore, we needed ObamaCare. And Obamacare and the exchanges were supposed to be the answer for all. But the insurance companies, since they're part of that, insisted on their own sharing, if you will, of that pool of premiums that were going in, because they didn't want to go out of business. They didn't want to be part of the government single payer program. But one little thing that I should point out too that's very interesting is Medicare Advantage has taken over for Medicare Supplement. Medicare Advantage programs in the country account for a larger and larger portion of the very profitable businesses of the tried and true BUCAs, the fully insured groups. So they're really focusing on that chassis. So we have to really be kind of cognizant of the fact that Medicare Advantage for everyone may be coming down the pike because they're pushing for it. It'll be very costly. The taxpayer won't have enough money, so that's a non-starter. So back to, can small businesses continue offering health benefits? They can if they have options. And one of the best ways to get that option is to opt out of insurance entirely. And let me see if I can, oh yeah. Hey. So as I said, group plans today for small groups under 50 employees, they are treated very unfairly. Large groups and all self-insured plans have many less mandates and regulations because they don't have the mandates for groups that are on groups of less than 50. So they have an advantage. And what's happening is the small groups are being kind of encouraged into looking at a lot of different strategies. They can cancel the benefit plan altogether. They can create an ICHRA program, as Charles talked about. They can limit the options to their employees, or they can ask their employees to pay more. Or they can provide access to alternative options. They can contribute less for the premium, or they can go out of business. Those are some stark realities there. And I really wanted to not talk about the ICHRA, because I think Charles is right. The sweet spot for a lot of the small businesses in this country are groups that are less than 20, sole proprietors, 1099s, a lot of people that are trying to pursue their own dream, but are saddled with mortgage-sized premiums, and they often have to make a choice between paying the premium for their insurance card or a successful business. And it's patently unfair. So let's see what the why an ICHRA is great for some. This slide basically reiterates what I just said. A lot of companies, and Charles is very right about the fact that NFIB .health calls themselves Healthcare 3.0. And one of the things that they've done is aggregate a lot of different features in one flat price. And they offer these options for people that are often 50% less than the premium with more robust benefits. They're unique because they're like crowdsourcing. They're like GoFundMe. They're like being a member of the Elks or the member of of a small group that where you pay a annual fee, and then like the Elks, where you pay $100 a year and you can go to the Elks Club anytime. Everyone shares in the costs of that. So the good thing about medical cost sharing is it is a member-to-member commitment. And one of the great things that MPB Health has developed is list bill enrollment, which mirrors what group plans, the services and abilities that group plans have now. One bill. They don't have to worry about a bill for each employee. So they can enroll, they can get billed, and medical cost sharing can be extremely viable option for people. One of the great things about medical cost sharing is that, particularly the group that we're working with, they put a very hard emphasis on healthy living and wellness. And we believe that healthy living and wellness commitments are rewarded. They are not in the fully insured world. The BUCAs don't do that. Everyone's treated one size fits all. You could be the healthiest person running marathons and not smoking, drinking little or none at all, great health, but you're paying the same premium as someone who doesn't do any of those. And it's an archaic way of creating basically a sharing system, which is insurance. The old days of mutual companies were the precursors of where we are now. And for whatever reason, we went into stock listed companies, and that really changed the nature of insurance from their vantage points. So I go on and on about this. The great thing about cost sharing is that they are innovative, but there are some dangers. And the dangers that I see are the insurance companies and state regulators don't like them. And then some employees are going to have to confront the fact that they are not eligible to get on medical cost sharing, and they will have to go with an ACA exchange due to pre-ex concerns. And then the most fundamental thing about marketing these programs is they are not for everyone. And any agent or advisor that goes out and tries, oh yeah, these are great for everyone that works for you, they're not being totally honest. And that's one of the problems that people that are in this business promoting even insurance programs, a lot of times they gloss over the bad things. So you can't do that. This is never insurance, never call it insurance. Don't even use insurance terms, and therefore it is not for everyone. Let's see what else. But hey, the future is bright, because I do believe innovation will win out, as did Uber and Airbnb and GoFundMe. You name the long list of forward-thinking, not doing it the same way as everyone else world. It is growing, and peer-to-peer networks are growing, and that's basically what we're talking here with medical sharing. And an interesting thing about what the ObamaCare did, unintentionally or maybe intentionally, they created plans that were only affordable for the insurance companies to do, where they were very high deductible. And that meant that for a lot of people that had to go for major medical, they had to confront the idea of coming up with cash, pay the first amount, the high deductible, before the insurance took over. And the interesting thing here that hasn't really been talked about, and it'd be a great marketing tool, is that cash paying consumers like cost sharing memberships. They just do. They're already understanding that you need to look around. You need to find like blue book type researches so that you can find the lowest cost provider and with the highest quality. You don't have to go to the local hospital. You may have to go 30 miles away to save $1,000. So I'm seeing that high deductibles, when we market it correctly, are creating cash paying customers. And then AI, one of the interesting things that we talked about a week ago at our weekly meeting is that using AI and DNA and a lot of other things that are available or will be available, you'll be able to create data-driven health outcomes. So someone that's born with a certain amount of DNA or a family history and it's all lumped into something, they may be 20% prone for bone cancer or whatever. Well, they can begin to either start saving for it, or they can modify their health, or they can do a lot of different things with knowledge. Knowledge is power, as everyone knows. And then one of the things, an outcome of the AI-driven, data-driven world is a healthier living means less need for medical care, and it means better sharing outcomes for everyone. So I'm not a negative guy. It's all up to the consumer and the great sharing companies in operation around the country to get the word out. All of us that are involved in this at all need to make an effort to contact your legislator, particularly the ones that represent you, because they don't know anything. The lobbyists, I'm sorry, Charles, but the lobbyists to get their ear first. And there are a lot of great stories, a lot of great sharing stories. I'll tell you one. A fellow from Syria immigrated here about 25 years ago with his family and took the plunge. He had a short-term policy with me, and then Connecticut decided short-term policies weren't good, so we kind of struggled to find an option. Well, last year, he found that he needed back surgery. He called the concierge, MPB. They searched around for the best priced surgeons and facility, and he preferred one hospital. And coincidentally, they were able to negotiate a deal, a surgery that would cost $90,000. They got it down to $55,000. And because my member was a cash paying customer, the facility insisted on being paid up front. And what happened? Sedera sent a check for the full amount to my member, who paid it, and he's doing very well. So there are great stories. We need to get them out, because you could go on Oprah and cry about the mean old insurance companies, and that would help us a lot. So that's basically my presentation. I think that companies need to really consider whether or not, particularly the 20 and less, they really need to consider whether or not they want to continue to be in the benefit business.
Yeah, I was going to say that to kind of flesh that out a little bit further, Rick, is that, that is a great comment. I remember calling on an account, and it was a tool and die operation. It was pretty good size, so they had a chunk of employees there. And I went and they had me come to the conference room. They had the whole table covered with all these spreadsheets and all the rest of this stuff. And he's explaining all this stuff about all Blue Cross and this and that and all these other companies. And I go, hold on one second. Let me ask you a quick question. When I drove in here, the sign said tool and die company. It didn't say you were a benefits brokerage firm. And he cracked up, and they all said, yeah, this is ridiculous. I said, you got to get out of it. I mean, you're in the widget business. That's what you need to spend your time on. And so the luxury of the list bill is, just to recap it, is that I'm the employer. I got all my employees. I'm going to say, look, I'm giving everybody $200 a month. They pick and choose amongst the medical cost sharing, choices there. And then I get one bill a month, and I put in my portion, and then I tax deduct, the balance from the consumer. Basically, the whole thing's just like a complete. But to me, as employer, it's great. I get one bill. I write one check every month. I'm done. And then one thing you didn't mention, and this seems to hold true across all of the medical cost sharing and even the Christian Health Ministries, their prices do not change by much from year to year. So unlike a normal insurance world where I got to have this whole big, like why I was there, because guess what? Everybody's prices were all up, and they're looking at all the different options, trying to figure out which is the least objectionable one here, because they all are horrible. But what's the least horrible one? So With this, I only have to just kind of re-up at the end of every year. Everybody like what you got? Great. Okay, boom, we're done. It was like 5 minutes and we went through reviewed our entire insurance program for our company.
Well, and that's one of the problems is that they only have a couple of options. These are our choices. Do you want A, B, or C? And many times it's only A, and this is how much it's going to cost you. And do you like working here? And you like, do you like what you're doing? This is our plan. They don't need to be in the health benefits business at all.
Or restrict those employees like you're describing, where they're stuck with the plan. And then like what ends up happening, I've seen, and you've probably seen this too, at the beginning of my company with you, I got a pretty good health plan. Costs were low, it's years ago already, and it's pretty full-fledged. Then the prices start going up. Next thing you know, we're bumping deductibles. I'm going to a skimpier plan. And before you know it, it's like a really horrible plan. Everyone hates it, but they're stuck with it. So either you keep working here and tough it out or whatever. And if they've got conditions, health conditions, they're kind of like, I hate working here or wherever, but I need the health care.
Yeah, one of the things that Greg talked about in his book, Mythbusters, which I recommend to everyone, it's an excellent history of the foibles of healthcare reform. I'll put that in quotes. He says one of the things is cash paying and having an HSA. And HSAs became so successful that they couldn't help but tinker with them. And they changed them from one of the best products out there for people to an also ran. I still love HSAs, but the difference in the premium used to be 40%. Now it's about 15%. So, regulators have to regulate. They can't help it.
Dr. Campbell, I see your hand up.
Yeah, Rick, terrific presentation. I'm trying to enter your world and understand it more. I've come to this first through creating a price transparency executive order, which I sent to Jeff and Charles. We've even had liberal groups take this. We had a nice public service announcement from a liberal group on the Oscars show on our price transparency. And I'm wondering, are you familiar with that? It began January 1. And is that something that could be helpful to creating these so-called blue books or understanding what real pricing is for facility fees?
Yeah, I totally agree. Transparency is the first step. And it's interesting that you say it would be nice to have liberals as allies, because they would be a natural ally of us if the marketing was better, if the experiences were better for people. They've got a knee-jerk reaction that these programs are bad for people, and they're actually the most socially responsible programs you can find. So that's a challenge for us. And transparency tools are extremely important. It's interesting that you say that also, because NFIB has been working with a company called Healthcare Blue Book, and they have got a soup to nuts program that is just phenomenal with ratings and all kinds of things. So you ought to check that out if you're working on a transparency tool. They've really good. They've done it right, and they've done it well.
Yeah, I mean, I'd like people who do this to be aware that it's now required that hospitals and surgical centers post their actual contracted fees with insurance companies. Now, not everybody's doing it. There's a $300 a day fine if they don't. But, my goal is to get these people shamed if they're not following the law, and get HHS to fine them if they're not following the law. And somehow we can leverage that. Now, the other thing is that, and I apologize, this is kind of two questions. I wanted to inform you about the transparency. I went to the Job Creators Network, which is a small business organization. I've got a big commitment from them that they want to do something big with cash, or I guess you'd call it the sharing models. So I went to Sedera. I did their whole program to become an affiliate. In other words, I learned how to sell their product. I went through the course, right, just to learn. And I'm trying to create the best sharing model that I can just squeak by the insurance commissioners, yet it's also familiar to the BUCA plans, to CEOs who are used to BUCA. And so that's one of the reasons why I've reached out to you, and I'll reach out to you again. But we're trying to create that sweet spot where we can do something on a big scale. I want to hit the country hard with a big sales team. So any perspectives on that, and Sedera or any other sharing plan would be helpful.
Well, we'll do this offline, and maybe we'll circle back tomorrow or Friday. Need a little bit more fleshing out of the idea. I don't know exactly where they can mesh, and I've been working with the BUCAs for a long time, and the guys in the office and I always talk about doing business with the BUCAs is like dancing with the devil. It's you just never know the next time they're going to change a rule, or they're just really hard to work with. And that's one of the reasons I love medical cost sharing, is because they are enlightened in my book. So, I think that one of the problems is that they haven't been able to market well. And I'm not kidding. Get on Oprah and tell a couple of great stories, and get the word out, because they really work for people.
I think what hurt them a little bit is they start out as Christian health share ministries. So some people are not religious. So that was an off-putting thing. And sometimes that was a religious target. So the whole thing sort of kind of got started with a cast in a weird place even to begin with.
They were fortunate, though, because of that. They were able to survive in the face of ObamaCare. Yeah. So
double-edged sword there for sure. Charles, I see your hands up.
Yes, you mentioned for the 20-person company and below, the list bill, which isn't true group. It's a way for the employer to say, hey, I'm just going to pay everyone's bill in one check, and you choose your plan, which is very convenient, which is important for the small business person who right now thinks this is really out of his reach. The new MPB list bill plan will go up to 49 employees. That's the big news this week, which is a game changer. Now it's not just the half dozen to get the sweet deal. It's now 49 and below. And through the MPB package, you get the sharing. You can choose the health savings account or the direct primary care relationship, or just the sharing. And then you can add the health matching account, which doubles your money over 3 years, because as you correctly said, Rick, the HSA, which I helped push in the early 90s with a couple of congressmen who were early adopters, was a great deal. I had an HSA plan, and then they had to require combining it with a high deductible policy that we embed and also include the free preventative to make it compliant. So anyways, I just wanted to add that about the list bill that now goes up to almost 50 workers, which is really going to make it easy to help the job creator network type people, other small business group associations, et cetera.
I couldn't agree more. I think that is a game changer. And I think there are more and more business owners who are really thinking hard about their future with group benefits, and whether they want to be an HR department or a widget manufacturer.
Totally forced it, though. Like you said, it suddenly became like a mortgage payment. And, if my overhead at my business was my employees was my biggest expense, and then kind of everything fell below that, suddenly that healthcare cost is so high. And I really care about my employees, but then now I'm at a quandary. Do I, screw them over, or do I just keep biting the bullet and hope for the best? It's really tough, but it's good timing. Like you said, if we can market a little smarter, they're right at the tipping point. They're definitely vulnerable to make that move. They just need to get.
Yeah, another interesting thing that happens too is that the family has to address the cash paying, and a lot of times they have enough cash for their mortgage payment sized premium, but they don't have any cash for the doctor copay, or they maybe a prescription drug that they need, because they're spent on their healthcare dollars. So this is really a very insidious thing, and we need to to give them and show them the way to relief. I do believe this is like a mission.
Charles, do you have a follow-up there?
Yeah, sorry, I thought I was muted here. I saw actually Dr. Campbell had a question about a bill. Maybe he could clarify what bill he was talking about.
Yeah, Charles, you said the list bill, which is is that a federal bill?
No, let me answer that, Jeff, if I could. Rick, why don't you tell the story of how you and I gave health protection to a friend of yours who had a sharing plan but wanted something else for his employees. It was about 5 employees or so. So what is the list bill, Rick?
Well, it's a funny story. The first piece of business that I did with NFIB Health was with a friend of mine, an NFIB friend from Connecticut, who he and his wife had been on Medishare for a long time, and I knocked on his door and we talked briefly about it, and then Charles gave us the solution of using list bill, which means we enrolled each person separately. They own their own policy, if you will, their own membership. And because it was set up on a list bill, like employee 1, 2, 3, 4, and 5 in one bill, that bill gets sent directly to the employer, and he just writes a check as he did before for insurance. But in this case, he saved 50% on the premium, if you will. And once again, this is not insurance. Never is insurance. We're never going to call it a premium. It's just the fees. So it was a great story, and it was a little clunky at the time. And as Charles indicated earlier, a lot of these groups have had growing pains, and I'm thinking that Sedera's on the cusp of going national, and I think that NFIB is very close to going national also. And I don't know, Bob, have you heard about their initiative with a direct primary care organization in the Orlando area? They have inked a deal with this group, and that is a fantastic way to get people up and running with medical cost sharing. And I see that as a paradigm for where we can really make penetration in the future. Get groups of doctors who are sick of waiting for the insurance company to write them a check, and they don't agree with the price. Now they can say, this is my price, and provide a lot of services that they never did before with insurance. So yeah, there's some things happening. I'm quite positive. We can just keep the regulators at bay for a little while longer. We'll be good.
Yeah, I think the DPC piece fits in perfectly. Of course, DPC isn't everywhere, and they can't right now take care of everybody. So you have to have a fallback. But even DPC doubters,
it's got to be somewhat regional
to figure that DPC really saves money and it keeps people healthy. So,
yeah, and in an instance with the DPC, if it's done right, that family doesn't have to worry about seeing the doctor, because being a DPC member, they can call and get seen right away.
Now, Sedera
a lot of good things happening that way.
How many covered lives do you think NFIB has currently? Like, I'm trying to get a feel for the market.
I'm not sure, Charles.
Jeff,
Sedera is the biggest, I would think.
I'm trying to think what the total number would be, because it's on a variety of platforms over these years, and we've been adding, 50 to 70 a month, and it's been, years of doing that. And then certain times there's big bump ups during open enrollment. And what's also happened a lot is, and this is a good indicator, a lot of the businesses become referral business.
Yeah.
Because finally their friend goes, tell me a little bit about that thing you're doing, because, man, I just got this letter and my premium went to X. And, suddenly they, the checkbook is pushing them. Because, again, like we've all experienced, better the devil you know than the one you don't. And all I knew is I've been at Blue Cross for years, and then I had Anthem, or, whatever they had, but they're all sort of the same. I have a copay, I got a card, and suddenly it's like, you're telling me I'm going to be paying cash, and it's like, I got to think about that. And then, of course, if it's a family, well, what if the husband and wife don't agree? Because that happens a lot. You know, the husband says, let's do it. And the wife's like, I don't like it. I like going to the same doctor, and I like the card in my wallet and whatever. So it's a real challenge right now until we get over that threshold of trepidation.
And Jeff,
that's what's holding it.
Charlie here, if I can add on that.
Sure.
You know, so NPB is a brokerage whose goal was to empower patients. And it just happened to be that sharing was the major medical piece. So we partner with Sedera, with Zion, and we'll add other payers as well. The problem with the sharing outfits is they're only major medical. They're not the first dollar where most people spend their dollars. Right. So we added the health savings account through a various mechanism, as well as DPC. And some of the sharing companies are doing direct DPC connections themselves. But what they don't offer, which we do, is the concierge shopping service starting at $1, because the sharing companies only help you shop when you need them, which is above the initial insurance amount, what we call the deductible. So above the $1,000 level on average. And unlike them, we'll help you shop for the tests, the primary care doctor, the first dollar coverage. And we also add the mental health benefits, discounts, and the AI functional assessments. A lot of things that we have decided is really the better package based on trial and error. Over years of trying to empower patients as shoppers, we realized we had to hold their hand. It is intimidating to negotiate this healthcare cartel. So if we don't help them shop for the cheaper test, the cheaper prescription, the cheaper specialist, or higher quality, they won't do it, and they'll run back to insurance and just slap down that card and say, you take care of it. So we have to be partners with the patients as we reform the system. And that's kind of what we learned.
Just to add to that a little bit, Charles, is the reality that when we did have a pretty robust DIY option, like you can call this person or you can just log into the site and just click here and do that. No one could click that. It's like, really, I can just call somebody. Oh, but that really facilitated them doing it. And in many ways was the reason they were recommending the company to their friends, was that the experience was so fantastic. Even if they still had to go through a hoop or two and the money's being sent to me and then I got to go pay. And so it's still a little weird, but the people are so awesome and they care about me and they help me. And then, like Charles said, all these great tools that help you figure out maybe I should change my diet. Because I always tell everybody, if don't get sick, what is Blue Cross doing for you today? Nothing. They took money out of my wallet. Right. But if you had something that took care of you when you got ill, but is helping you prevent becoming ill, doesn't that sound like that makes more sense? It was like, yeah. And lo and behold, they cost less money, which seems counterintuitive, but it's true. So it is pretty interesting world that we're at. We just need to.
It's about 40,000 people, to answer your question, Dr. Campbell, between Sedera and Zion are two sharing partners at this point. And then, we've brought around 10,000 people to that overall list. I may be off on the numbers because Sedera is always in these fastest growing company lists in Austin, Texas. And Zion has exploded in the last few years as well. So, give or take around 50,000 lives. And, everyone knows the million person number for the entire sharing market itself. So it's really maturing.
Yeah, Sedera, I think Sedera has about 40,000 lives right now.
Oh, that's much more than I even knew. That's last time I checked was a year ago.
Yeah. And so, that's why I went to them first. Do you think I can sell Sedera in New York State? New York City?
Well, that's why we added Zion. So if you actually work with us, Dr. Campbell, and Rick could talk to you about that, we're in all 50 states, regardless of which sharing partner we use for whichever situation. That's why, we encourage folks to get in indirectly through an agency like us, where we see the sharing companies as vendors. We want them to compete for our business because sometimes they fall down on the job. They may restrict natural reimbursement. They may leave the states, any number of complications. So we like to be a broker to give our business and individual customers whichever vendor is trying to meet our demands for the ultimate customer experience.
Plus, each has a different sweet spot too. You know, the Zion's a little different profiled customer potentially than would take the Sedero model. So it's good to be able to, and again, there's so much business to go around. No one company could manage all of it. It would just collapse them under the crush of it, which we've seen when the Christian healthcare ministries took off and a couple just grew too fast. They didn't control their growth and they just fell down immediately on customer service, which is what everybody was looking forward to getting. So
how many agents do you have? How many agents do you have?
I want to say we're up to probably about 30 or so.
Okay.
Because we were up to a big number. We were up to hundreds.
Mm-hmm.
But then everything just kind of collapsed when a bunch of things changed and the sharing ministries kind of pulled back and stuff. So then we regrouped, and that's when we partnered with Sedera. So we had to kind of rebuild. And we lost a bunch of our extraneous, second tier, part-timer type agents all disappeared. And then suddenly all these other ones have come back now that all of this list bill options and all the rest of this is accrued. Now because they're looking for, look, I'm not like abandoning selling somebody Blue Cross, but if for some reason the guy goes, look, I'm not going to just drop this. I can't afford anything anymore. I'm done. I don't want to lose the customer. Hey, Bob, I got a back pocket thing. Hold on one second. Did I tell you about this? So they're treating it either as a back pocket thing or a door buster. I want to break in. I want to steal the business from you. I'm going to come and say, hey, did the agent you currently have tell you about this option? Oh, no, the guy never brought it up. Oh, well, here, he's doing you a disservice. Let me tell you about it. So it has a way to penetrate, but what's great about it is this DPC marriage is going to be good because this is the template for what they're going to do everywhere else. And we've had a lot of individual DPCs come on over the several years, but never like a big DPC group with multiple offices come on. So now we get to execute like that broader approach. And that's going to be real easy to refine because it's just what we've been doing a little more slicked up and processed, cleaned up. But then that's it. Then we can take that on the road anywhere, which is going to be great. Because like you said, it's not going to be for everybody. And DPCs can't manage everybody. But for the people that are able to get one, man, the doctor's happier than a clam. The patients are loving it. They got readily good access. Prices are low. And where we fit in so beautifully is because everybody goes, oh, you mean if I have medical cost sharing, you mean I got to pay for my little $100 doctor visit because I didn't, break the unshared amount? Yeah, that's what you do. But with a DPC, now suddenly they can go to that person and feel like that's happening at no cost to them or minimal cost when really they're paying a monthly fee. But just the execution of it feels more like what I like and I'm used to. And so that's why and like you said, too, their goal is to make you healthy, not just kind of figure out what pill to prescribe today because you're just rolling through my office for 15 minutes here, hit the clinic, so it's a big deal. So, Rick, you have any last thing you'd like to chime in here on tonight, or how do you want to leave it for all of us?
I would say that contact your small business friends, your entrepreneurs. Let them know about this option. We need to get it out there and market it to people that can benefit from it, that understand it. And I'm, as I said, I'm basically optimistic. I think innovation's going to circumvent the regulators, and they're going to have to deal with it in a more positive fashion in the future.
What a great place to end it on a high note. So that's really good. And thanks so much for being here tonight.
My pleasure. Nice talking to you guys.